Hello, this is Dr. Gay from First Look MRI, and this is a 19-year-old male with a seizure disorder. And when patients have a seizure, we always do an MRI scan to screen for any abnormality that may be serving as a seizure focus. So if a patient has a stroke, or they have a developmental anomaly where the brain is not right, or if they have something called mesial temporal sclerosis, or a brain tumor, or other findings, they can have that serve as the seizure focus. So we're just screening for that. Oftentimes the brain is just completely normal and we're not sure where the seizure focus is, and that's always a problem. So here we go. This is a coronal thin section view through the temporal lobes. This is what we use to look for mesial temporal sclerosis. This is a common cause of seizure disorder. So this is the left temporal lobe, and this is the right temporal lobe. We're looking straight at the patient, and there's an area right here called the mesial temporal lobe, and there's an area here, the hippocampal formation. The right and left hippocampal formations should be symmetric. The cortical gray matter here should be thick and bright, similar to the other cortex, and we should have no asymmetry. When this is involved with mesial temporal sclerosis, it can become abnormal in signal, and over time it can shrink and become atrophic. And when it does, a little potential space can fill up with fluid above it. So we look for asymmetry, abnormal signal, and is there a little fluid collection on one side that would indicate atrophy. And in this patient, things look nice and normal, so no evidence of mesial temporal sclerosis. We look for an infarction or hemorrhage, we don't see that. And we look for brain tumors. And now in this patient, we do see something peculiar back here in the left. So this is the left parietal lobe, and we see something abnormal. So at first glance, it looks like, ooh, this could be maybe a tumor. Looks irregular, but looking at this more closely, there's no mass effect. It looks like there may be a little channel from the outside of the brain that goes down into this, and there's a couple little blips of low signal. These are little fluid collections, and the cortical gray matter here is thick and bright. So this looks like an area of focal cortical dysplasia, just a small area of the brain that did not develop correctly. We can see that little cleft here and the abnormal signal in the small region of the brain. So this is just a development anomaly where the small section of the brain did not develop correctly, and this is serving as their seizure focus, an example of focal cortical dysplasia.